Okay, imagine this. There's this unseen force, totally microscopic, right? And it's somehow siphoning off billions, literally billions of dollars from a huge global industry every single year.
Yeah, or think about how a tiny virus, one you've probably never even heard of, can just completely shift the economics of farming pigs worldwide.
Well, that's exactly what we're digging into today.
We are unpacking the story of porcine circovirus,
Yeah.
PCV for short, and this whole collection of diseases it triggers in pigs, which we call PCV-associated diseases, or PCVE.
Right. And our mission here for you is to really get into the weeds of this surprisingly complex story. It's got this unexpected history, these really varied impacts.
And some pretty ingenious ways people figured out how to fight it.
Exactly. So you're going to walk away understanding not just the science bit, but the real so what? Why does this matter to a massive global industry?
And, it seems niche, but it actually offers some crucial lessons about managing diseases generally and these hidden economic battles in modern farming.
So what are we basing this on? Where's the info coming from for this deep dive?
We've drawn from some really comprehensive reviews and also excerpts from key veterinary disease handbooks, sources that really give you the full picture of this significant little virus.
Okay, let's unpack it then. The circoviruses. You mentioned they're tiny.
Oh, incredibly tiny. They're among the absolute smallest viruses known
Okay.
that can replicate all on their own in mammals. Just minuscule.
Wow. So where does the story start?
It actually starts pretty quietly with PCV1. It was found way back in 1974,
Okay.
almost by accident, really. It was just a contaminant in a lab cell line, something they used for growing other things.
And it wasn't causing any problems?
Nope. For decades, everyone thought it was completely harmless, just, something you find in labs sometimes, no link to any actual disease in pigs.
But then things changed because we mentioned PCVA.
Right, then things changed dramatically.
Yeah.
Late 1990s, suddenly this new player emerges, PCV2. And this one was different,
Us.
genetically different, antigenically different from PCV1. And it wasn't harmless. It was the main culprit behind this devastating condition that just swept through young pigs, post-weaning multisystemic wasting syndrome, PMWS.
Wasting syndrome. Sounds bad.
It was terrible, pigs just fading away. And PCV2, well, it caused enormous economic losses, just huge all across the globe. Billions, like you said earlier.
So it went from this harmless lab finding to a global economic disaster basically overnight.
Pretty much a massive shift. And the story didn't stop there. The family kept growing.
Oh.
More recently, 2016, researchers found PCV3. It's been linked to signs that look a bit like another condition, PDNS, which we'll get to. Also reproductive failure in sows, myocarditis, inflammation of the heart muscle in fetuses.
So another problem virus.
Well, its exact role is still sort of debated. Is it a primary cause on its own? Research is ongoing. It's complex.
Okay.
And then just in 2019, PCV4 pops up, identified in China.
Another one. What does that one do?
Similar signs, again, respiratory problems, gut issues, those PDNS-like signs too. And experiments have confirmed it can cause disease.
But we don't know the full impact yet.
Exactly. Its full impact, how widespread it is, that's still being figured out. So you see, it's a constantly evolving picture.
Right. So these different PCVs, what does it actually mean for the pigs? You mentioned wasting, but what else? What are these PCVA syndromes?
Yeah, it's definitely more than just wasting. There's quite a range.
So let's start with the classic one, the wasting syndrome, PMWS. What's that called now?
Right. That's now generally called PCV2 systemic disease, or PCD2-ACD. That's the one that really grabbed headlines initially.
And the signs.
You see this progressive wasting. Like, the pigs just get thinner and thinner, really emaciated. Their hair coat gets rough. Skin looks pale. Often they have trouble breathing. You might hear it called thumping. Their lymph nodes get visibly enlarged, sometimes diarrhea or even jaundice, a yellowish tinge.
And what age pigs does this usually hit?
Typically younger pigs, sort of post-weaning, usually around 6 to 14 weeks old. That's a really vulnerable time.
And if a pig gets it, what are its chances?
Sadly, very poor. The case fatality rate for pigs showing those signs is often incredibly high. We're talking 70, even 80%.
Wow. That's devastating for a farm.
Absolutely devastating. And when you look inside a pig that's died from it, the lymph nodes are just huge, maybe several times their normal size.
Okay.
The lungs often don't collapse properly. They feel kind of rubbery. And under the microscope, you see what's really going on. The virus is just destroying the immune cells in those lymph nodes. It's called lymphoid depletion.
So it basically dismantles their immune system.
Exactly, which leaves them wide open to everything else.
Yeah.
You also see specific types of inflammation, these giant cells, and sometimes actual clumps of virus inside the cells.
Okay, so that's the systemic disease, but you said there were other forms, something called PDNS?
Right, porcine dermatitis and nephropathy syndrome,
Mhm.
PDNS. Very different picture. This one often hits suddenly. Pigs seem really depressed that they stop eating, but the really striking thing, the memorable detail, is the skin lesions.
Lesions?
Yeah, these irregular blotches, red to purple, often on their back legs, belly, around the tail. They can turn black and necrotic, meaning the tissue dies. It looks pretty dramatic.
Yikes. And nephropathy means kidneys, right?
Exactly. Internally, the kidneys are the other big target. They get enlarged, look pale, but they're covered in these tiny hemorrhages, little bleeding spots.
Oh, wow.
It gives them this very characteristic look that vets call a turkey egg appearance.
Turkey egg kidneys.
Yeah.
Memorable indeed. What's causing that?
It's basically a widespread inflammation of the blood vessels all through the body, systemic necrotizing vasculitis. And in the kidneys, it specifically damages the filtering units. It's thought to be an immune reaction gone wrong.
So the immune system attacking itself almost.
Kind of, yeah, an over-the-top immune response causing damage, rather than the direct immune cell destruction we see in the systemic form.
Fascinating. And it also affects reproduction.
Yes, PCV2 associated reproductive failure, or PCV2-RD. This affects pregnant sows and gilts,
Leading to?
things like late-term abortions, more stillborn piglets, mummified fetuses, or piglets born very weak.
And is there a key sign there internally?
In the affected fetuses, a common finding is myocarditis, that inflammation of the heart muscle.
Gotcha. And you briefly mentioned respiratory and gut issues.
Right, PCV2-associated lung disease, PCV2-LD, and enteric disease, PCV2-AD. PCV2 is often a player in what's called the porcine respiratory disease complex, basically, a mix of bugs causing pneumonia. PCV2 makes it worse.
And the gut.
It can contribute to diarrhea, poor growth, again, often working with other pathogens.
Okay, so this virus is a real multitasker, but then there's this other angle you mentioned, the subclinical stuff, the hidden iceberg.
Ah, yes. This was a huge realization. For a long time, everyone focused on the obviously sick pigs, the ones with PMWS or PDNS.
Like tough.
But then researchers started looking closer at herds that seemed, basically healthy, and they found something crucial.
What was that?
Even in pigs with no obvious clinical signs, pigs that looked fine, PCV2 infection was still having an effect. It was subtly dragging down their performance, reducing their average daily gain, how quickly they grow, and making them less efficient at converting feed into muscle.
So even if they don't look sick, they're not doing as well as they should be.
Exactly. And when you multiply that small drag across thousands, millions of pigs, it's a massive economic drain.
Wow. So the cost isn't just the dead or obviously sick animal.
Not at all. That discovery was a real paradigm shift. It showed the economic impact of this subclinical infection was actually far, far greater than the visible disease. It's this constant hidden tax on production.
Okay, that really puts it into perspective. So how does this tiny virus manage to cause all this trouble? How does it stick around and spread so effectively?
A lot of it comes down to its structure. PCVs are non-enveloped viruses.
Meaning, what does non-enveloped mean in practical terms?
It means they don't have that fragile outer fatty layer, that envelope, that many other viruses have. Think of it like they're wearing armor plating.
Okay, so they're tough.
Incredibly tough. This structure makes them really stable, very resistant to environmental challenges. They can survive low pH, like stomach acid. They can handle heat, say 70 degrees Celsius for 15 minutes.
Wow.
And they're resistant to many common disinfectants that would easily kill enveloped viruses.
So cleaning up isn't straightforward.
Not at all. This toughness allows them to just persist, to hang around for really long periods, on surfaces, in manure, in organic matter, just waiting.
Which makes transmission easier, I guess.
Absolutely. Transmission happens horizontally, pig to pig, through direct contact. Think saliva, nasal secretions, feces. The fecal-oral route is important.
Makes sense.
But also indirectly through fomites.
Omites, that's contaminated objects.
Yeah, exactly. Boots, clothing, equipment, trucks, trailers. These are major ways the virus gets moved around between pens, between farms. A huge biosecurity headache.
Any other ways?
There's even evidence for airborne spread, at least over short distances.
Jeez. It seems hard to stop.
It is. And then there's vertical transmission.
From mother to offspring.
Yes. The virus can cross the placenta during pregnancy. This can cause those reproductive problems we talked about.
Abortions, stillbirths.
Right. Or and this is really significant, it can lead to the birth of piglets that are already infected, and viremic meaning the virus is circulating in their blood right from day one.
Oh, wow. So they're born infected.
Yes, and this leads to this idea of the Trojan piglet.
Trojan piglet, like the Trojan horse.
Exactly. You have this piglet, looks maybe okay at birth, but it's carrying a huge load of virus, and it starts shedding that virus immediately, massively, into the nursery environment.
So it's like a little virus factory spreading it to all the others.
Precisely. It creates this intense infection pressure right when piglets are mixing and most vulnerable. It can really drive outbreaks in the nursery.
That's a really powerful concept. Does it spread other ways from the sow?
It can also be shed in her colostrum, the first milk, and later milk. And it's been detected in boar semen, too.
Does that mean AI, artificial insemination, is a big risk?
The risk from AI seems to be pretty low, at least with semen from naturally infected boars. But it's something researchers keep an eye on.
So back to this persistence. You're saying it's not just in the pig pens?
No, studies have found viral DNA, often at high levels, not just in the pens, but on things like workers' boots, their clothes, even in farm offices on the edges of the farm property.
Everywhere.
It really highlights how easily this virus moves around and how it can set up these persistent reservoirs of infection. Makes control a real challenge, day in, day out.
Okay, so it's tough, it spreads easily. But this raises a key question. If it's everywhere, and most pigs get infected, why do only some get severely sick? Why isn't every infected pig a disaster?
That's the million-dollar question, really. And the answer is that PCVAD is multifactorial.
Multifactorial, meaning lots of things involved.
Exactly.
Yeah.
Getting infected with PCV2 is necessary. You can't get the disease without the virus, but it's often not sufficient on its own to cause severe clinical disease.
So infection doesn't automatically equal disease?
Correct. It's usually a complex interplay, kind of a perfect storm of factors that need to align for things to get really bad.
Okay, so what are these other factors? What tips the balance?
Probably the single most significant trigger or exacerbating factor is co-infections.
Other bugs hitting the pig at the same time.
Exactly. When a pig is dealing with PCV2 and another virus, like the PRRS virus, porcine reproductive and respiratory syndrome virus, another major issue.
Right, heard of that one.
Or certain bacteria, like Mycoplasma pneumonia, which causes pneumonia.
Yeah.
That combination can be explosive.
Why? What happens?
The presence of these other pathogens seems to dramatically ramp up PCV2 replication. The PCV2 virus multiplies much more, and the resulting disease becomes far more severe. They sort of help each other cause damage.
Okay, so co-infections are a big one. What else?
Host factors play a part too. Genetics seem to matter. Some breeds, like landrace, appear maybe a bit more susceptible. And the pig's immune status is absolutely critical. Remember when PCV2SD typically hits 6 to 14 weeks?
Yeah, post-weaning.
Well, that often coincides exactly with the time when the protective antibodies they got from their mother's colostrum are starting to wear off.
Right.
So their own immune system isn't fully mature yet, and mom's protection is fading. Bad timing.
Right, a window of vulnerability.
Precisely. And then there are environmental and management factors.
Like stress.
Absolutely. Things like overcrowding, mixing pigs from different sources or age groups, poor air quality in the barn, inadequate hygiene, maybe nutritional deficiencies. All these things act as stressors.
And stress weakens the immune system.
It certainly can. It compromises their ability to cope, making them more likely to succumb to severe PCVA if the virus and maybe other pathogens are present.
So it really is a combination of the virus, the pig itself, and its environment.
That's a great way to put it. Now, how the virus actually causes the damage, the pathogenesis.
Yeah, what's it doing inside the pig?
Its main target is the lymphoid tissues. Think lymph nodes, spleen, tonsils, the headquarters of the immune system.
Okay.
And the central event, especially in that systemic wasting disease, is this profound lymphoid depletion we mentioned.
The destruction of immune cells.
Right. It wipes out key immune cells, B cells, T cells. This causes severe immunosuppression. It cripples the pig's defenses.
Making them vulnerable to everything else.
Exactly. That's why secondary bacterial infections are so common and often contribute to the severe signs like pneumonia or diarrhea. The pig just can't fight them off anymore.
But you said PDNS, the skin and kidney one, was different. It wasn't immunosuppression.
Correct. It's fascinating, really. PDNS seems to involve immune hyperactivation, not suppression.
So the immune system going into overdrive.
Yeah, it's thought to be what's called a type 3 hypersensitivity reaction. The immune system forms these complexes, antigen-antibody complexes involving the virus. But instead of clearing the virus, These complexes get deposited in the walls of small blood vessels throughout the body.
And that causes problems.
Big problems. It triggers this intense inflammation in the blood vessels, that systemic necrotizing vasculitis, leading to the skin lesions and the kidney damage.
So the same virus can either shut down the immune system or send it into damaging overdrive.
It seems so. Two very different pathways leading to serious disease. It really highlights the complex relationship between this virus and the host immune response.
Okay, so diagnosing this must be tricky then if infection is so common but doesn't always mean disease. How do vets figure it out?
That is the absolute critical distinction. You cannot diagnose PCVD just by finding the virus or antibodies against it.
Because most pigs have been exposed anyway.
Exactly. PCV2 is pretty much ubiquitous in pig populations worldwide. A positive test just tells you the pig has encountered the virus or maybe been vaccinated. It doesn't prove the virus is causing the current problem.
So how do you prove it? What's the gold standard?
It's what we call the tripartite framework. You need 3 pieces of evidence to line up.
Okay, what are they?
1, you need the characteristic clinical signs in the pig. Is it showing wasting, or PDNS skin lesions, or reproductive failure signs?
Makes sense. Step 1.
2, you need to find the specific microscopic lesions in the affected tissues when you examine them after death using histopathology. Are those characteristic lymphoid depletion patterns there? Or the vasculitis for PDNS?
Okay, signs plus lesions. What's the third?
The third, and this is crucial, is demonstrating the presence of the virus within those specific lesions. You have to link the pathogen directly to the pathology you're seeing.
How do you do that? See the virus in the damaged tissue?
Usually with techniques like immunohistochemistry, IHC, or in situ hybridization, ISH. These methods use labeled probes to detect the viral proteins or genetic material right there in a tissue sample within the areas of damage.
So signs, lesions, and virus in the lesions, all 3 together.
That's the gold standard. That's how you confirm PCVAD.
What about other lab tests? Like PCR, that detects genetic material, right? Isn't that useful?
PCR is incredibly sensitive, yes. It's great for detecting the presence of PCV2 DNA in blood, tissues, oral fluids, whatever.
Right.
But again, because the virus is so common, a positive PCR result is very frequent, even in perfectly healthy pigs. So a positive PCR confirms infection, yes, but it doesn't on its own diagnose the disease.
Even if there's a lot of virus, like a high viral load.
A high viral load found by quantitative PCR is more correlated with disease. Sick pigs tend to have much more virus than healthy carriers. But it's still not definitive proof by itself. It's supporting evidence. But you still ideally need those other 2 parts of the triad.
So the IHC or ISH showing the virus in the damaged tissue, that's really the key diagnostic differentiator.
Absolutely. Those are the techniques that provide the definitive link between the virus and the lesions, confirming its role in causing the disease in that specific animal.
What about antibody tests? Serology, like ELISA.
ELISA tests detect antibodies against PCV2. They're not very helpful for diagnosing disease in an individual sick pig.
Why not?
Because again, most pigs will be seropositive, meaning they have antibodies either from natural infection, which is widespread, or from vaccination, which is also very common now. A positive antibody test doesn't tell you why the pig is sick now.
So limited use for sick pigs, but are they useful at all?
Oh, absolutely invaluable, but more for herd management.
How so?
You can use serology on groups of pigs to monitor when they're getting exposed to the virus, or to map out how long the maternal antibodies from the sow are lasting in the piglets.
Ah, so you can figure out when that window of vulnerability opens up.
Exactly. Knowing when maternal antibodies decline helps producers optimize the timing of piglet vaccination to make sure it's most effective, avoiding interference.
Clever.
You can also use it after vaccination to check if the vaccine took cover. Did the pigs develop an antibody response? So, great for herd-level monitoring and strategy, less so for diagnosing individuals.
Gotcha. And I guess you always have to rule out other diseases, too.
Definitely. The clinical signs of PCVAD wasting, breathing problems, diarrhea, skin lesions, sudden death, they overlap with a lot of other common swine diseases.
Like what?
PRRS, swine influenza, salmonellosis, erysipelas, Glasser's disease, the list goes on. So differential diagnosis, considering and ruling out other possibilities, is always essential.
Okay, so it's complex to diagnose definitively. Let's talk about fighting back. If we connect this to the bigger picture, how did the industry start to get a handle on this?
The absolute game changer, the watershed moment, was the development and introduction of PCV2 vaccines. That happened around the mid-2000s.
And they worked.
They worked incredibly well. It was revolutionary. The rollout of effective vaccines dramatically reduced the incidence of clinical PCVD, like PMWS and PDNS, across the globe.
So vaccination became standard practice pretty quickly.
Very quickly. It's now routine in most major pig-producing countries. In the U.S., for example, estimates are that over 90% of pigs get vaccinated against PCV2. It just became essential.
What makes the vaccine so effective? What do they actually do?
They do several key things. They significantly reduce the amount of virus circulating in the pig's blood, that's viremia. They reduce how much virus the pig sheds into the environment.
Less shedding means less spread.
Exactly. They also reduce the severity of those microscopic lesions in the lymphoid tissues. And of course, they significantly reduce mortality rates.
And what about that hidden subclinical cost? Do they help there too?
Yes, and that's crucial. Vaccinated pigs, even if they get exposed, perform better. They have improved average daily gain and better feed efficiency compared to unvaccinated pigs, even in the absence of obvious clinical signs. So vaccines tackle both the visible disease and that hidden economic drain.
That's huge. Now, there are different strains of PCV2 out there, right? PCV2A, 2B, now this PCV2D. Do the vaccines cover them all?
That's a really important point. Most of the original commercial vaccines were based on the PCV2A genotype. But the great news is that these PCV2A-based vaccines provide really good cross-protection against other major genotypes, including PCV2B, which became dominant for a while, and also against PCV2D, which is the most dominant genotype in many parts of the world right now.
So the older vaccines still work against the newer strains?
Largely, yes. That cross-protection has been incredibly valuable. However, because the virus does continue to evolve, companies are now also developing and releasing newer vaccines specifically based on the PCV2D genotype, just to stay ahead of the curve.
Makes sense. How long does the protection from a vaccine dose last?
The duration of immunity is generally considered robust, lasting for at least 4 to 5 months, which is long enough to cover that main risk period for pigs, through the nursery and growing phases.
Okay, so how do producers use these vaccines strategically? You mentioned timing was important.
Right. Strategic vaccination is key to getting the most benefit. For piglets, the most common approach is a single dose given around the time of weaning, typically at about 3 weeks of age.
Why weaning?
It's a convenient time, and often it aligns well with that decline in maternal antibodies we talked about.
Yeah.
You want to vaccinate when the piglet's own immune system can respond well, but before they lose maternal protection entirely, if possible.
Are there other piglet strategies?
Yes, some programs use a 2-dose regimen, maybe starting even earlier, like at 3 days of age, with a booster shot a few weeks later. The best timing can depend on the specific farm, the level of maternal antibodies, and the vaccine being used. That's where serology can help guide the decision.
What about vaccinating the mothers, the sows, and gilts?
That's another really important strategy. Vaccinating the breeding herd helps stabilize immunity across the whole farm. It prevents those reproductive losses, the abortions, and stillbirths.
Okay.
And critically, vaccinating the sows boosts the level and uniformity of maternal antibodies they pass on to their piglets through colostrum.
Ah, so it gives the piglets a better, more consistent start.
Exactly. Higher, more uniform maternal antibodies can help protect piglets during those first few vulnerable weeks, reducing the risk of early infection, reducing vertical transmission, and lowering the overall viral load the piglets might encounter initially.
So vaccination and piglet vaccination work together.
They really do. It's often a combined approach. But, and this is vital, vaccination isn't a magic bullet on its own.
You mean you can't just vaccinate and forget everything else?
Precisely. Vaccination works best, synergistically, when it's combined with good biosecurity and good management practices.
How do you mean synergistically?
Think of it like fire safety. Vaccination reduces the spark, it lowers the amount of virus circulating and being shed. Good management and biosecurity reduce the fuel. They limit the opportunities for the virus to spread and contaminate the environment. You need both for the best control.
Right, makes sense. What kind of management practices are we talking about?
Well, some foundational principles were laid out years ago by Dr. Francois Madec in France, his famous 20 points. They're still incredibly relevant.
Like what?
Things like reducing stocking density, not overcrowding pigs, minimizing the mixing of pigs from different sources or age groups, ensuring good air quality and ventilation, strict hygiene protocols, limiting cross-fostering of piglets between litters, which can spread disease. Just sound husbandry basics.
And what about bigger systems, like how pigs flow through a farm?
That's where all-in, all-out, or AIAO production systems are incredibly effective.
All in, all out.
Yeah. The principle is you move a whole group, a batch of pigs, into a facility, say a nursery or a finishing barn, together. They stay together as a group, and then they all move out together.
And
And then before the next group comes in, the entire facility is thoroughly cleaned, washed, disinfected, and allowed to dry.
breaking the cycle.
Exactly. It breaks the chain of transmission between consecutive batches of pigs. It's a cornerstone of modern disease control for many pathogens, including PCV2.
And you mentioned cleaning and disinfection. That must be extra important given how tough this virus is.
Absolutely non-negotiable. And the order matters. You have to do a thorough cleaning first, remove all organic matter, manure, dirt,
Why first?
because that organic material can physically shield the virus and also inactivate many disinfectants. So clean first, then apply an effective disinfectant.
And which disinfectants work against this tough, non-enveloped virus?
You need products known to be effective against non-enveloped viruses.
Yeah.
Things like oxidizing agents, glutaraldehyde-based products, sometimes bleach, sodium hypochlorite, used at the right concentration and contact time. Following label instructions is key.
Okay. And general biosecurity, keeping the virus out.
Critical. Controlling the movement of people, vehicles, equipment, onto and within the farm. Things like shower in, shower out procedures for staff, providing farm-specific boots and clothing, disinfecting any supplies coming onto the farm, controlling pig movements, sourcing healthy animals. It's a whole package.
And one last piece.
Yeah.
Managing those co-infections you mentioned.
Yes, that remains crucial, especially for preventing the severe forms of PCVA. Having effective control programs in place for other major players, like PRRS virus and Mycoplasma pneumonia, is really important.
Does that involve vaccines for them too? Or medications?
Often both. Vaccines for PRRS and Mycoplasma are widely used. And sometimes, strategic use of antimicrobials might be necessary to control the secondary bacterial infections that take advantage of PCV2's immunosuppression. It's about managing the whole health picture.
Wow, okay. It's a multi-pronged attack needed to control a multifaceted virus. So let's talk bottom line. The economics, you said billions. Can we quantify that?
We can try. PCVA, particularly before widespread vaccination, was undoubtedly one of the most economically devastating diseases to hit the global swine industry, ever.
What were the direct costs?
Primarily from increased mortality, losing pigs. Then, reduced growth rates, that lower average daily gain. And worsened feed conversion efficiency, pigs eating more feed to gain the same amount of weight.
Any dollar figures?
Estimates varied, but in severe outbreaks, the direct cost per pig could easily reach, say, $20 or even more in some cases, when you factored everything in.
Per pig. That adds up incredibly fast on a farm.
Incredibly fast. But remember the hidden cost.
The subclinical drag on performance.
Exactly. That silent drain across entire populations, even in seemingly healthy herds. Estimates for that subclinical cost often fall in the range of $3 to $4 per pig.
$3 to $4 on every pig, even if it doesn't look sick.
Potentially, yes. Across millions and millions of pigs globally. You can see why it was labeled a massive economic drain. The subclinical impact financially outweighs the clinical impact.
Are there other costs too? Indirect ones?
Sure. The cost of diagnostics, trying to figure out what's going on. Increased use of medications to treat secondary infections.
Yeah.
The cost of implementing vaccination programs themselves, although that's an investment.
Yeah.
Also, lack of uniformity. If pigs grow at different rates, it makes marketing groups more difficult. And sometimes, severe outbreaks could even lead to trade restrictions between regions or countries.
So the costs ripple outwards. But vaccination changed things. What's the return on investment there? You said it was an investment.
It's proven to be a very high-yield investment. Several economic analyses have looked at this. A commonly cited figure suggests a return of around $6.60 for every $1 spent on PCV2 vaccine.
Wow, a 6.6 to 1 return. That's impressive.
It really is. That return comes from reduced mortality, definitely, but also significantly from those improvements in average daily gain and feed efficiency and lower cost for other medications. It just makes solid economic sense.
Okay, so vaccination has been huge, but you mentioned the virus evolves. What's the future look like? Is the fight over?
Definitely not over. It's more like an ongoing arms race. One key thing is that PCV2 actually evolves quite rapidly for a DNA virus, almost more like an RNA virus in its rate of change.
Really? Why is that significant?
It means new variants and genotypes can emerge relatively quickly. We saw that shift from PCV2A to PCV2B being dominant, and then PCV2D taking over in many areas.
So we have to keep watching it.
Absolutely. Continuous genomic surveillance sequencing viruses from the field is essential. We need to monitor for new variants, track genotype shifts, and constantly assess if our current vaccines are holding up against what's circulating out there.
And what about PCV3 and PCV4, those newer ones?
That's another major area for future research. We really need to clarify their precise roles. Are they significant primary pathogens on their own?
Yeah.
Do they require specific control strategies, maybe specific vaccines down the line, or are they more opportunistic? We need more data.
And vaccine development itself, is that evolving too?
Yes, we're seeing those next-generation vaccines
Yeah.
based on PCV2D coming out.
Right.
There's also interest in developing multivalent vaccines, maybe one shot that protects against PCV2, PCV3, maybe even PRRS or mycoplasma to simplify programs.
Combination shots, basically.
Kind of, yeah. And exploring novel vaccine platforms, too, maybe
Yeah.
using viral vectors or even mRNA technology like we've seen for human vaccines recently. Lots of innovation happening.
Any advances in diagnostics on the horizon?
Diagnostics are getting more sophisticated, too. Things like digital droplet PCR or ddPCR allow for much more precise quantification of viral load than traditional qPCR. Maybe that will help differentiate clinical versus subclinical states better in the future. And there's always research into faster, cheaper, maybe even pen-side biosensors.
So technology keeps pushing forward on all fronts.
It has to. The PCV story really is this powerful example of how veterinary science and the livestock industry can face an emerging crisis, figure it out, develop tools, and adapt to manage it on an ongoing basis.
Yeah.
It's moved from crisis to management through science.
It's a fascinating journey. So we've covered a lot today. This tiny, tough virus, the diverse diseases it causes, the hidden costs, and the fight back through vaccines and management. You've really learned about this dynamic dance between a pathogen and a global industry.
You really is a dance, constantly shifting.
So here's a final thought for you, the listener, to mull over. This constant evolutionary arms race we see here between PCV and our interventions, what does that tell you about the future of disease control? Not just for pigs, but for all living systems, including us. And are there other unseen costs, like that subclinical PCV2 drag, lurking in other industries or systems that maybe we haven't even thought to look for yet, costs that could be unlocked if we did similar deep dives?